Welcome to Ahar Arogya Adhyatma, the light of Samskara. Today we have a renowned ophthalmologist from Kalburgi. He has conducted more than 1,000 free eye checkup camps, and he has operated on more than 50,000 eyes. And today we are very happy that he is with us to describe about the diabetic retinopathy. We all know that diabetes is not a disease, it is a metabolic syndrome. So it affects all parts of the body, all the blood vessels, so leading to heart attack, stroke, as well as gangrene, losing the limbs. Anywhere the blood supply is there, that part can be affected. So he is going to describe to us what happens inside the eye when the diabetic is there. Sir, after how many years of diabetes they develop the retinopathy and what happens to the retina?
Good morning, madam. Diabetes mellitus is one of the leading causes for blindness in India now. Because almost in every house, we are seeing one patient of diabetes.
Yes.
And as you know, there are two types of diabetes, or juvenile diabetes and stress type 2 diabetes. But both the diabetes, they affect the eye as they affect the other organs if you neglect the disease. And the blood sugar level, it exceeds more than 200 postprandial for prolonged period. God gives a lot of time to recover. He has got diabetes, tomorrow he will not develop retinopathy. It takes time, 3, 4, 5 years, it may time, provided your sugar is under control, not much changes will happen. But the sugar level exceeds above 200 for a prolonged period, and he is likely to get the diabetic retinopathy. Not only retinopathy, diabetes affect all the parts of the eye, right from lid, conjunctiva, cornea, lens, vitreous, and also the paralysis develop the lateral muscle commonest, you will get the diplopia, lateral leg palsy, then the retinopathy. It takes time. Suddenly it might not affect. It may take 3 or 4. Usually after 5 years, it affects the eye. What happens? Diabetes is the disease which affects mainly the venous system of the blood circulation, whereas hypertension affects the artery system. So diabetes, usually what happens, the blood veins, which are called sheathing covering, they lose the sheathing, the cells, they die. So the blood in the venous wall is percolates through outside the vessel and leaks in the retina. That's called microaneurysm. And it affects mainly the central vision, that is at the macula. So a patient having diabetes for 5 years, he should thoroughly undergo fundoscopy. That is the first part of the then he may not have much problem, but a doctor detects there are some microaneurysms. It's called a background diabetic retinopathy. If you neglect, it goes to proliferative retinopathy. So the diabetic patient would undergo thorough checkup when she's got diabetes, but do not be worried. Keep always sugar under control. So this is how the retinopathy affects.
Okay. So the patient may not, because most of them, because of the taste and they feel like eating sweets and they end up with the high blood sugar and they may come with blurring of vision. And suppose, what are the complications that can occur in the retina, like hemorrhage or detachment, and how exactly you tackle them?
The commonest diabetic retinopathy affected retina is hemorrhage. Because earlier there are hemorrhage very small, we call microaneurysms. The vessel wall leaks and the blood inside the vein falls on the retina. There are microaneurysms. It mainly affects the central part of retina, that is macula. This can be detected by some tests we call retinal function test. We do some fluorescein angiography. We a dye called fluorescein injected in the vein, and within seconds it comes to the retina, and if there is leaking vessel, you can see the which part of the retina, which part of the vein it is leaking. You can record it and make it with the fundus camera. You can make a drawing of the retina. After confirming the part of the retina, and we do some other test called OCT, optical coherent test, how the macula is affected, where is the edema, where is the inflammation. Depending upon all these tests, then the surgeon decides which part of the retina affect. And after that, what we do in simple language is, like the leaking pipe, water pipe, we do soldering. That like we do soldering of the retinal vessels, it's called as a photocoagulation. Using a laser beam, the surgeon in a topical anesthesia, he hits the laser beam on the particular vein where it is leaking, and the laser beam, it seals the vessel, so further bleeding from the retina is affected. That's what he does. Done under topical anesthesia. First, they do grid photocoagulation. If the retina is hemorrhage throughout the retina, then they do call as pan photocoagulation. If the patient cooperates, it can be done in one sitting. Sometimes patient may not cooperate. He may feel pain, the throbbing pain you may get. Then the surgeon stops. It can be done on 2 or 3 sittings. So by doing this photocoagulation, the further visual loss can be prevented.
But whatever is lost cannot be brought back.
It cannot be. Nervous tissue. Once the retinal, you may get some scotomas also. When you put laser beam, but the retina is lost, that is burnt out, burning. So that reflects as scotoma. You may see some black spots in the retina. That is common. But we will prevent the further loss. We will not make patient blind. That is what the surgeon should tell the patient. This is what we are doing. And the hemorrhage is more. Then he may not see the retina. Then they have to inject some injection called intravitreal Avastin. Then the drug with thins out the what is clot. Then you can
dissolve the whole clot.
It can be done in 1 sitting or 2 sitting, depends upon the clot. We can be little costly. After that, once the doctor can visualize the retina, then he can do photocoagulation. That is the part.
Suppose the patient is ignorant and they have not come, they have delayed. And what will happen to them if they come when the fibrosis occurs and then detachment occurs, retinal detachment?
Patient doesn't come if he neglects. First, God give chance. What I said, background retinopathy. Small, even if you neglect, then there will be a lot of big clots will there. And the clot, they will not keep quiet. They'll get fibrosed. Pull the retina from where they come. So retina which is there, it get detached. Got retinal detachment. Once the it is nervous tissue, it loses its nutrition and blood supply, it dies, and the patient becomes permanently blind. If the detachment is of arm duration, detachment comes very early, you will feel it. Some curtain is falling in my eye, patient comes and say, when you throw light, you can make up a battery, a fundoscopy or indirect ophthalmoscopy, you can make out the retina, which part of the retina is detached. If central retina is intact, you may get little vision. If central retina is torn out, then it is difficult to repair the eye. And there are some procedures they do. Buckling surgery, they do some silicone eye, they put a tamponade effect, try to attach the retina. It all depends which part of the retina is affected. Whatever we do, we give very good result. So the posterior segment we call, the area behind the retina is called as Shunya Kanda. The part which is anterior to the retina is called Karma Kanda. So cataract surgery, Karma Kanda means you will get good result. The Shunya Kanda, the surgeon feels I had done very good surgery, very good, but patient may not get good vision. Only we have to expect further loss of vision is prevented. It is the Shunya Kanda, that is the retinal surgeon. That means they are not much popular surgeons, retinal surgeons.
Yes, sir. So many times, the women are so busy like taking care of their family and their husband, and they hardly bother about their health and they come late. So what is your suggestion or sutra for these people to take care of their eyes?
I always tell the women, see the diabetes, mellitus, it is called affect the 4 pathis. We got 4 pathis: retinopathy, neuropathy, nephropathy, angiomyopathy. So you try to neglect your pathy and try to love this pathy to take care of. And he will not make you blind. So he is that pathy will be there, but don't neglect this pathy. This diabetic retinopathy, you would then neglect means you have to take more care. Periodic checkup of blood sugar level, go to physician. Don't eat whatever happens, you eat 1 gulab jamun. The surgeon says you like it. So don't neglect. You will try to love this diabetes pathy. Then he will also love you. He will take care of you. Otherwise, if you neglect, all 4 pathis will leave you. This is what I tell you.
This is what you have learned from your professor, Dr. Tirmalachar. So love your pathy, but don't neglect your eyes so that you get into the 4 dangerous pathis. So thank you very much. Doctor. Thank you very much, Dr. Uday Patil, for explaining so beautifully about the diabetic retinopathy. Thank you, sir.
Thank you. Thank you.